Hey guys, so to begin, understanding our healthcare system is relevant in community psychology because our society is rapidly changing and growing. Community psychologists play a very important role in the impact of the health status in many communities. Community psychologists are able to develop programs and preventative interventions to keep populations healthier. They have more of an opportunity to deliver changes within communities and implement and manage a valuable service to many people. Having a better understanding of our healthcare system can bring more reliable and sustainable programs to communities. So currently in our healthcare system, there are a lot of issues in the United States. So one of the main issues would be the high cost of healthcare. In 2009, the U.S. spent nearly $8,000 per person with healthcare, while Canada spent $4,000, Germany spent $4,000, and France, I think, spent $3,000. Simply put, the U.S. spends more money in healthcare than other countries, although we have less services than those countries. We are charging higher prices for regular goods and services compared to everybody else. According to the Washington Post, other countries negotiate and fight with providers for lower rates than the U.S. does. The government of these countries step up for their citizens and make sure that the rates are lower so that everyone is treated accordingly. Another issue would be managed care, or HMOs, which is basically insurance through our jobs. This is an issue because many people don't have jobs, and two, they don't have insurance through their jobs. And then another one would be COVID-19. There's lots of people right now that are not working and not paying for these coverages, so they don't have insurance. An example would be me. I haven't been working since March, and the last time that I went to the doctor, I had to pay $70 out of pocket because the insurance I had with my job was not good anymore. Also, racial and gender biases is very apparent in healthcare. African Americans are less likely than whites to receive a variety of medical procedures for the same issues. Other issues will include quality of care, mistakes by hospitals, and medical fraud. As of right now, I oppose repealing the ACA. Back in 2017, President Trump promised to remove the ACA and replace it with affordable insurance for everyone, but that has yet to take place. So the reason I oppose it is because until there's something else to replace it, why will we remove it? Because it's still helping a lot of low-income individuals. If the ACA is repealed, they'll be leaving individuals that are sick with higher rates, and the ones that are getting treatments right now will have to stop because they will not be able to afford it. Also, the ACA will be damaging to a lot of young adults like myself because under the ACA, until the age of 26, you're allowed to be covered under your parents' insurance. So if it's removed so quickly, companies will go back to their 18 and 21 age limit, leaving a lot of people with no coverage. A lot of young adults are in college and working part-time, and being under their parents help them a lot. I personally am against purposely hurting and harming other individuals, so I believe everyone's situation is different, and as of right now, the ACA is helping a lot of poor people and keeping them alive. So if I revert back to where it said that one of the main issues in our current system is medical fraud and also quality of care. There are less nurses in certain hospitals, so they have to treat more people, which makes it a lot harder on them. Especially right now with COVID-19, there's a high demand for nurses, and they're not getting paid well enough to be working with so many people. And then two, there are a lot of people that are sick coming into the hospital that don't have any coverage, so they just have to end up paying all that stuff out of pocket. So if I go back to repealing the act, yes, I am against it. There are a few good pros, our taxes being less, and we won't be paying our taxes towards insurance, but I personally don't think that's a pro. I don't really see how that helps anybody. I personally feel like taking a few dollars out of my taxes to help towards a cause to help people of low income is not a bad thing. I still believe that it should not be repealed. If President Trump stays by his word and brings in the Trump Care, where he did say that he will be giving insurance to everybody, so that means that everyone will be getting insurance under Trump Care. I will support that because that would be helping a lot of people. But as of right now, if we repeal Obamacare, the ACA, and there's nothing there to take over the ACA, it's just ACA is gone, there's nothing here, everyone's gonna go back to how it was before under Medicaid and Medicare, and lots of people will not have insurance. Lots of people will be going to hospitals with no insurance, getting kicked out of hospitals because they will not get treated because one, they already don't have money, and two, now they have no insurance to cover these needs that they obviously need when they go to these hospitals. So I'm against repealing it because it just doesn't make sense unless there is something there to replace it. If Obamacare is taken out, Trump care should be coming into the law to replace Obamacare. It shouldn't be Obamacare is gone and there's nothing else there, because that's not helping anybody. It's really just harming a lot of people that can't afford insurance. Insurance is already high. As I said before, in the US, per one person, it's almost $8,000 to get covered in a year. For any issues that you may have, you're paying all this money, but where is it going? Because there's a lot of people that are getting turned away when they go to hospitals because there's no insurance to cover, they don't have any money. So all that money that's been taken away from one person, where is it going? And I personally feel like I said, I'm against harming people. I'm against purposely hurting people and taking away something that's helping a lot of people. It may not be helping me. I'm not under my parents. I have my own separate insurance, so it's not like helping me in any way, but it is helping a lot of people that I do know, or people that I don't even know. It's really helping them, and I don't see how it would be fair to remove that from them. I feel like health insurance shouldn't be a commodity. It should be something that's given to everyone because everyone gets sick, everyone goes through things, and unexpected things happen in life, and we shouldn't be charged 4 times our living wage just to go to the hospital to get our regular care. Well, thank you guys.